right, guys, wear gloves around any dog infected with leptospirosis. So here's some infected pee right now, and I can't touch this because lepto is a zoonotic disease, which means it can infect pet parents like you behind the screen. It can infect humans. So that is why a veterinarian or vet tech is gonna be wearing gloves if you have a dog that's diagnosed with lepto. So don't be offended, they're just not trying to get this disease. So you guys know I love educating pet parents and veterinary students, so I've made this video as easily digestible as possible by preparing some slides for you that are gonna tell you everything about leptospirosis that you guys can reference whenever you want. So we're gonna cover how your dog gets this, what animals carry it, the geographical locations of leptospirosis that it's most prevalent, the clinical signs your dog is gonna show if they're infected and sick, and then how to treat it and how to prevent it. So you're gonna learn a lot, hang tight and stick with me. Let's get into this. Oh my God, guys, you're still here. So that means you want to learn about this pee disease, as bad as I want to teach you about it. And I'm wearing these orange pee scrubs to match the video. Can't you tell? I'm going to put a link in my description below where you guys could shop for these Barco uniforms. All right, so the way your dog is going to get leptospirosis is from urine, if you haven't picked that up already. The urine tray, urine scrubs. All right, so it's pee. We got to avoid pee, and mainly from rats. So rats are the main ones to give it to dogs and humans even, but also other animals carry this, such as pigs, sheep, goats, cattle. So farm workers are the other ones that really get infected with leptospirosis, or people that are gardening a lot, who are in the environment where there is urine infected with leptospirosis. So what is lepto anyways? So lepto is a bacteria. So it's actually a bacteria, and there are 4 or 5 different serovars of this. I'm not gonna get into this in this video. People in vet school are probably like rattling them off in their head. Icterus hemorrhagicum, Pomona, Gribbion typhosa. You know what I'm talking about. So those ones are specific to different animals. Lepto is found in the Midwestern, Eastern, and Southeastern states with heavy rainfall and flooding, and in big cities with lots of rats. But a fun fact is, for some reason, cats rarely get this. So don't even worry about your kitty cats. It's just our dogs we have to worry about. So I swear these cats, they get away with everything. They even eat the rats and they don't get it. Maybe they use one of their 9 lives on it, who knows? So how do our dogs get this? I know I kind of joked about it earlier, but they get it from urine, by ingesting urine. Even if it gets into their mucous membranes, a cut, a wound, or in their gums or their eye even, they can get lepto. So what happens is these rats carry it and they're peeing around New York City, let's say, imagine that. And it's going through the sewage systems, and you're walking your dog in the city and they're licking puddles that are there because, you know, dogs just lick everything on the floor and pick up stuff on the floor. And they ingest the urine from the rats that have lepto in it. Or if they're out on a farm or in the woods, they can get infected by any urine that's in the soil or in moving water. What does this leptobacteria do? It likes to attach to cells that line blood vessels, and this starts to affect organs. Specifically, lepto likes to affect the liver, kidneys, and even the lungs. So how do you know if your dog has been infected with lepto? So what clinical signs are they gonna show? Actually, some dogs don't get sick at all. Their immune system takes care of it, they clear the bacteria from their system, and they don't get sick. While other dogs can get really sick, and they can come in for vomiting, being lethargic, weight loss, not wanting to eat, having flu-like symptoms, having a fever over 103.5, and just overall being sick, and a client is concerned. And then other things lepto can cause are respiratory issues and bleeding disorders. Dogs might even have little petechiae or blood clotting issues on their skin that an owner notices. So this is where history becomes important for your veterinarian. Was there just a flood or a heavy rainfall in your area? Did your dog drink water in the city? Were they at dog parks that they normally don't go to? Or did you go hiking in the woods? So these are things that are gonna help your vet diagnose lepto in your dog. So here's a slide that's gonna show you how your veterinarian is gonna diagnose lepto. It's pretty easy, guys. They're just gonna need some blood and urine. So they're gonna send it out to the lab, which they're gonna do a DNA or PCR test for a bacteria strain of lepto. Then your vet is gonna call you and let you know that your dog has this, and you're gonna have to put on the gloves and be careful because remember, it's a zoonotic disease. Humans can get this. So the treatment of leptospirosis is antibiotics. And the one that we pick is doxycycline. So your dog is gonna be on doxycycline for up to 4 weeks. And then you're gonna have to retest for lepto later. But if your dog is also having those other signs of respiratory issues, or they're really sick, having kidney disease or liver disease, your dog will most likely be hospitalized on IV fluids and other antibiotics to get them through this. And the good news is a lot of dogs have completely recovered from leptospirosis. But in some sad cases, the prognosis can be poor if it's not caught early. Quick story before we get into prevention is I actually worked on 2 cases of leptospirosis when I was at Tufts University in Massachusetts, and they have a huge dialysis machine where they filter the dog's blood and put it back into them if they're having severe kidney disease. It is super cool, but it does cost thousands of dollars. I think the bill was like around $15,000 to $20,000. So how do we prevent your dog from getting lepto? There is an effective vaccine. So you can ask your veterinarian to give your dog the leptospirosis vaccine. As puppies, they can get this starting as early as 8 weeks old and then boosted every 2 to 4 weeks. And then they should get this annually as an adult if you live in those geographical areas that I said earlier where lepto is more prevalent. Another preventative measure is making sure your dog isn't drinking contaminated water in the environment, like lapping up all that water in the street, in the sewage system, or when you're on a hike, drinking slow-moving water down a stream. Just don't let them do it. I actually get a lot of DMs about this. People are like, my dog just ate from a puddle, are they gonna be okay? And I'm like, how do you know? Like, what are you scared of? You know what I feel like asking these pet parents? And they don't even know. And there are a lot of bacteria in there, like lepto, which is one of them, that could infect your dog. So you really shouldn't let them chug all that water. It's just common sense, right? All right, guys, I hope you learned a ton. I hope your brains aren't exploding right now. Make sure to subscribe to my channel, hit the thumbs up so this video circulates to other pet owners like yourself, and I will see you next week.